This video is going to highlight and cover a couple of the self-treatment options we have for tarsal tunnel syndrome. So if I were stranded on an island, what would I do to help push myself in the right direction and find some relief of this heel pain that I am feeling? So I'm going to start with a golf ball, and we are going to do some trigger point work or myofascial release. And the posterior, on the tibialis posterior muscle, this muscle goes from basically follows the path of the calf. It goes down to inside of the ankle, and so trigger points are often found up higher in the belly of this muscle. And I'm going to use a golf ball. Any sort of trigger point ball will work, a lacrosse ball. We just want to be able to put a little bit of localized pressure in this area. You might kind of scan through the region with a foam roller first, find any tight or sore spots, and then dial in on those. But I'm just going to go straight to it with the golf ball here, and then I'm putting some pressure through the area, rolling my foot and ankle around, looking for any tight spots through that region. If I find a spot that feels especially juicy, I'm going to hang out there, and I'm going to work right on that spot with a little bit of inversion eversion, so tilting of the foot in and out while I keep some pressure on the trigger point ball. I'm just probably looking at a region here about the size of a deck of cards or so on the back of your calf. If you don't have calf muscles that are that big, sorry, shrink your cards. And that's going to be pretty focal up here at the top region of where that posterior or tibialis posterior tendon muscle belly is. So in addition to that, we can help mobilize the soft tissue, some of the superficial tissue, and potentially a little bit of the nerve here. So I'm going to use light tension here to help mobilize the nerve at the ankle, and I'm going to use my thumb right through here, and then we're going to start with the ankle down, and then we're going to bend the ankle, so toes towards your nose sort of movement. So light pressure with the thumb as I push down through this tissue with my thumbs here. So right around the ankle, not looking to dig in super hard here. 4 or 5 passes through this area would be plenty. If you notice you're starting to produce some tingling or numbness, you're probably pushing too hard and you've done too many reps. You should not produce any lasting symptoms with that therapy there. The last exercise or last treatment I'm going to do on this area is going to be the tibial nerve floss. So I'm going to start here with my leg pulled up, foot pulled, toes pulled back and out, and then as I go up with my leg, I'm going to look back behind me towards the wall and then look down towards my chest. So at one end of things, we are tightening the tension on the nerve, so as the leg goes up, and at the other end, remember your nerves are all connected, so as the tension builds here, I'm going to decrease tension by taking my head back. And that's why we call it a nerve floss or a nerve glide, because we're moving both ends of the same system. So about 10-15 reps of that nerve glide, plus some myofascial release or trigger point work with a ball, and then a little bit of direct release work here right over the inside of the ankle where that nerve courses through the region.